Time now for Medical Monday. Dr. Darkabani, a neurologist with Aurora Bay Care, here to talk about Stroke Month. So tell us a little bit, first of all, start off, what is a stroke?
Stroke is basically a disease that affects the patient where sudden interruption to a blood supply to a certain area of the brain that might affect the patient. In a way, usually it's either weakness in one side of the body, visual changes, language or speech difficulties.
Are there any people more susceptible to having a stroke?
Usually patients who have history of high blood pressure or diabetes, smoker, have higher risk. Obviously, age is one of the most important risk factor. Every 10 years, usually the risk might double when it comes to stroke as well.
Okay, what types of things should we be looking for? If we think somebody might be having a stroke, what should we be on the lookout for?
So recognizing the sign of stroke is extremely important. Usually, American Heart Association recommend the term FAST or ACT FAST. F stand for facial weakness, A, arm or leg weakness, S, speech difficulty, and T, time to call 911.
So if you think somebody's having a stroke, you should do all of those four things. You know, ask the person to smile. What other things? Ask the person to raise their arms. And then what happens? They can't do those things?
If the patient cannot do them, or if they notice any subtle weakness in the arm or leg, or any difficulty getting the words out, if the smile looks a little crooked, basically what the family can do, they can call 911 right away. The faster they call 911, the faster the patient gets to the hospital and receive the immediate care.
And that was my next question. You can survive a stroke, right?
Absolutely.
You can survive.
If the patient arrives within a good time, patient can receive the best management. We have medication called clot busting medication, can open the vessel. We have new techniques and new technology where we can go to the catheter, with the catheter to the clot and suction the clot or pull the clot out and give the patient best chance of recovery.
Another thing, what should we be doing to prevent, to kind of, help our chances of never having a stroke?
Obviously live a healthy lifestyle, avoid smoking, management of high blood pressure, diabetes, any risk factor that might be associated with a stroke or heart attack. All those advice can help to reduce risk of stroke in the future.
All right, thanks so much for being with us, Doc. We appreciate it. For more information about the signs and symptoms of strokes and to learn more about Stroke Awareness Month, just head to our website, NBC26.com. Well, May marks the beginning of Mental Health Awareness Month across the United States.